Hey everybody, this is Rob Wilson with Performance Therapeutics and Prepare to Perform, and I'm going to talk to you guys a little bit today about how to self-treat your psoas. And your psoas is a deep muscle to your abdomen. It's literally the filet mignon of the human body. It's gigantic, it's a very powerful muscle. It's a huge contributor to lumbar spinal pain and problems, anterior pelvic tilt, all kinds of issues. Its main job is to stabilize the spine, one, but also it creates some hip flexion when your torso is fixed, or it can create forward flexion when your leg is fixed. Psoas gets really brutally stiff on lots of folks for lots of reasons, namely because, one, people don't really know how to brace their trunk properly, so it gets overworked because we find ourselves in an overextension moment a lot. And then the other reason is it really responds to high levels of stress. So people are stressed out all the time, it gets stiff. So really the question is, what do we do about it? There's a variety of ways to get access to it. It's really deep, you have to be really careful. Some therapists would prefer that people not treat themselves because there's vital organs and stuff around there. So the psoas is deep inside your hip. Basically, if you put your thumb on your belly button and you put your pinky on your hip bone, where your fingers are, that's the area where your psoas is, right? Now, around that, we have all kinds of abdominal aortas, and there's all kinds of veins and nerve tissue that runs from your spine out into your legs. There is some slight chance that you could create a problem there if you are dumb. Don't be dumb. If you're pushing on stuff and you're working around there and you feel a pulse, hey, that's something that's pumping blood. Don't push hard on that, okay? If you're pushing around in there and you're trying to work your beef jerky out and it feels like an electrical signal down your leg, hey, that's a nerve. Don't push on that, all right? So just use good sense. If it feels weird, then it's weird, so don't do it, okay? That being said, stay away from the center of your belly. Your abdominal aorta is there, so just don't put sustained pressure on your aorta. That doesn't even sound smart, right? Sustained pressure on your aorta. Don't do that. So here's what we're going to do. First thing is, in order to get access to this thing, it's usually best to lay on your back, and you can either prop your feet up on something, put your feet on the wall, or just bend your knees, put your feet on the floor. Then what you're going to do is use that trick we were talking about earlier, where you put your thumb on your belly button and your pinky on your hip bone, and then where your fingers fall, that's the top of your psoas generally. Alright? Now what I have here is this neat little contraption that I made with a PVC pipe and a Super Bowl and some duct tape. Also works, top of a hockey stick, grip of a golf club, anything that's not sharp and is small enough to maneuver. Alright, so you find your spot, put your tool there. Now there's no reason to try to shove it in there and eviscerate yourself. Just let the weight of your arms do the work. Take some nice deep breaths, and it might take a minute just to sink into that puppy. Don't be afraid to change directions. You can go out here. Some of that tissue is right on your pelvis, so you can go out that way. You can kind of go down. You can get a little bit closer to your leg. Don't be afraid to fish around in there a little bit. And again, if something feels weird, stop doing it. Ask a soft tissue expert if you're in the right area, and make sure you're doing the right thing. Otherwise, don't be scared, alright? It's your body. If you are willing to partake in a sport which almost certainly will create some damage to your body, this is pretty innocuous. So fish around in there, find something that's stiff, and then wait it out. Take a nice deep breath and just let yourself soften into it. Alright? So that's a good start for starting to treat your own psoas. I think a lot of you guys will be really surprised how horrendously stiff and uncomfortable that tissue is, and it shouldn't be, right? Because if you take this same thing and you put it in your forearm, it doesn't take your breath away, right? Well, this is muscle, this is muscle, all right? So just because you put some pressure into the tissue doesn't mean it should be horrible, right? Ah, it just feels like that there. No, that's wrong. All right, so we want to get this nice and healthy so that your spine can move the way it's supposed to.